Hi, my name is Olivia Boris, and this is Brooklyn and Mize Building a CDI Program project. For this project, we decided to build a CDI program for UPMC Magee Women's Hospital, which is located in Pittsburgh, PA. This facility is a short-term acute care facility and has about 367 beds in the hospital. They are accredited by the Joint Commission. On average, this facility has about 18,000 discharges per year, which is about 49 discharges per day. To this date, UPMC Magee has brought in a total revenue of about $5.5 billion and a net income loss of about $134 million. This facility is also known to be a teaching hospital and currently has about 105 full-time interns and residents. UPMC Magee offers multiple clinical services such as emergency services, oncology services, orthopedic services, and other services such as hemodialysis and obstetrics. They also offer radiology, nuclear medicine, and imaging, as well as rehabilitation services, special care services, sub-provider units, and surgery services. CMI scores indicates the clinical complexity of a case, and the average CMI score is typically 1.5 or higher. The higher the score indicates how well the department is functioning. The three departments with the highest CMI scores were vascular surgery with a score of 3.0043, surgery with a score of 2.3694, orthopedic surgery with a score of 2.2871, and the three lowest scoring departments were obstetrics with a score of 0.9414, orthopedics with a score of 1.0105, and cardiology with a score of 1.2510. When building a CDI program, it is important to decide what the mission and vision statement is going to be. The main goal for our CDI program is to improve the quality care and performance, as well as improve the concurrent review rate for queries. When staffing a CDI program, it's important to decide what department the program will reside under. For this, we chose to put it under the HIM department. CDI reviewers should report to the CDI program leader and physician CDI leaders, who then should report to the HIM department leader and chief medical officer. The executive sponsor for this CDI program will be the chief medical officer, and the physician advisor will be someone who has the most experience in the hospital and the most background knowledge on multiple departments. The CDI core team will consist of HIM, quality management, a coding manager, a physician manager, a CDI program manager, and the financial analyst. This allows for the program to get insight from multiple departments to be as successful as possible. For this program, there will be 12 CDI reviewers. On average, there is 18,123 discharges per year, and there should be one CDI reviewer for every 1,500 discharges per year. The CDI reviewer job title will be a CDI specialist, and their job description includes reviewing medical records for completeness and accuracy, educating physicians. They must have clinical documentation training, and they also must have experience with health information. They must be able to train and communicate with physicians and other staff members. This would include if there are errors within the query or the query response rate is taking too long. They must be able to communicate with physicians and guide them on how to complete the queries properly, as well as how to submit them in a timely manner. It is recommended for them to have a bachelor's degree in a health-related field, an RHIA certification, and a CCS certification. They could also have other certifications such as an RHIT and other coding certifications, but these are just the ones that we focused on for our program.
Hi everyone, my name is Brooklyn Dietz, and Olivia and I decided that my part would be to cover training, queries, program reviews, and analysis measures and recommendations. So training for our facility, physicians and staff will undergo a 5-hour in-length training. The training will cover videos and PowerPoints on what the query and coding standards are for this organization, with emphasis on maintaining quality care for a patient. The staff will be assessed on their trainings via exam, which they will receive post-training. There will be trainings conducted yearly, but assessment until the next training and exam will just be purely observation of the facility tasks, such as how physicians and the nursing staff are dealing with patients on a day-to-day basis. On the left-hand side here, you'll see the training plan that we drew up. First, you have the title of the training, Quality Care and Performance. The trainers that are responsible for the training would be the CDI manager, the HIM manager, and the CDI specialist. The training goals would be to understand proper data collection, being updated on current standards, and proper data analysis skills. Participants for this training would be the CDI staff, physicians, nursing staff, and the HIM staff. Next, you would put down the date and time that your training would take place and the materials needed for the training and assessment, such as types of technology, stuff of that nature. So for our queries, the type of query that will be exercised for our CDI program is open-ended. We feel as if this allows the physician to be as independent as possible in exercising independent physician judgment. So for example, number 1, we have Dr. Brown. According to the chart, the patient presents to the facility with feelings of dizziness. The patient had labs done that showed the patient's hemoglobin level at a 10. The progress note notes that the patient was diagnosed with anemia. Would you be able to further specify? Example number 2 says, Dr. Brown, the patient has presented to the facility today with muscle cramps and weakness. The patient chart notes that the patient has a low sodium level and an order was put in for 9NS. Using independent judgment, can you further specify the condition being treated? We would like to put the standard for our queries for the deadline to be within 24 hours. That way, this helps speed up the coding and reimbursement progress, ensuring quality care for a patient. So for program reviews and analysis measures, the types of charts being reviewed are both inpatient and outpatient at this facility. The method of review for outpatient services will be concurrent, and the method of review for inpatient services will be retrospective. What will be done to decipher whether a patient's symptoms are present upon admission or hospital acquired will be detailed concurrent documentation of the patient's illness, making sure the physicians and nurses are capturing everything about the patient's visit with detailed information. Data elements that will be measured to monitor the program's effectiveness will be those such as query rates, coding metrics, reimbursement, and revenue metrics. Examples of reports for dashboards that will be used to track the program efficiency will be patient reimbursement rates, number of queries being sent out daily, average patient wait time, etc. The targeted audience for such dashboards will be the hospital CEOs, HIM managers, and the CDI managers. So some recommendations for a new coming CDI program in terms of technology would be a dictating system. This would allow physicians to document every piece of data from the patient visit concurrently without missing any important information. With doing this, it will speed up the clinical process as well as the reimbursement process, which in turn improves the quality care that the patient received. And these are our sources. Thanks.